Hey, Professor Brox, it's Taylor for my head to toe assessment. I have my note card here on to one side, no flip ups or anything like that. I have my patient here. Is it okay that you're on camera?
Yes, it is.
Okay, perfect. So I'm here for the assessment, so I will go ahead and get started. Hi, my name is Taylor. I'm going to be your student nurse for today.
Hi, how are you?
Hi, good. Can you verify your name and date of birth for me?
Benton Hui, August 31st, 1970.
Okay, perfect. And Ben, can you tell me where you are right now?
I'm in my house,
And do you know about what time it is?
about 8 p.m.
And do you know why you're here?
to see a doctor.
Okay, perfect. Thank you so much. I'm here to do a head to toe assessment on you before the doctor sees you. It'll take about 20 minutes or so. There's going to be some light touching and some moving around. Is that going to be okay?
That's fine.
Okay, perfect. So patient is alert and oriented ×4. Patient is well groomed, well nourished, dressed appropriately for the weather. Speech and body language are appropriate for content. I'm going to go ahead and get started with some vital signs, okay?
Okay.
Ben, are you having any pain today on a scale of 0 to 10? 0 being no pain, 10 being unbearable.
0?
Okay, perfect. And can you put this one under your mouth for me? Under your tongue? Perfect. Okay, awesome. So oral temperature is 98.0. And oxygen saturation is 96% on room air. I would have a bedside table that would be at heart level for the patient. I'm going to be checking your blood pressure. Is it okay to use your left arm?
Yes.
Raise your arm here. And just keep your feet flat on the floor for me, okay? Patient's blood pressure is 112/70. I'm going to be checking your pulse. I'll be here for 1 minute, okay?
Okay.
Okay, perfect. So patient's respirations are 20. And heart rate is 70. So I'm going to go ahead and raise the bed up. So patient's skin is warm and dry, consistent with ethnicity. There's no visible lesions. And let's see. Can you smile for me, Benton? And frown? And puff out your cheeks. Close your eyes and raise your eyebrows. Okay, perfect. So cranial nerve 7 is intact. Patient is also 23 out of 23 on the Braden scale. And the skin turgor is within normal limits. So head is normal cephalic, hair is evenly distributed, face is symmetrical. And do you have any pain or pressure here?
No.
And what about when I do that?
No.
Perfect. So maxillary and frontal sinuses are non-tender. I'm going to go ahead and take your glasses off, okay?
Okay.
And just stare straight ahead at me. Okay. And then I'll have you follow my pen light just with your eyes, okay?
Okay.
So eyes are perla and EOMI with no nystagmus. So cranial nerves 3, 4, and 6 are intact. Then I'll have you go ahead and bend your arm for me at a 90-degree angle.
Okay.
Go ahead and read the lowest line for me that you can.
574268.
Okay. So patient's vision is 20 out of 30. So therefore, cranial nerve 2 is intact. And take a look at your ear here. Okay. No lesions on the external ear. And I'm going to go behind you here. Go ahead and cover one ear for me. Repeat what I whisper.
Purple.
Perfect. Cover the other ear.
Pink.
Okay. Awesome. So whisper test is within normal limits. Cranial nerve 8 is intact. Ben, I'll have you go ahead and plug one nostril for me. Breathe in. Any issues there?
No.
We'll do the other side. Okay. Any issues?
No.
Perfect. Tilt your head back for me. So bilateral nares are patent. I have a cotton ball. Go ahead and just tell me what you smell.
Rubbing alcohol.
Okay. So olfactory nerve, cranial 1 is intact. I'm going to go ahead and take a look inside your mouth now. Open for me. And say ah. Okay. So oral mucosa, buccal mucosa, and tongue are pink and moist. There's no broken teeth. There is rise of the uvula and the tonsils. So cranial nerves 9 and 10 are intact. Ben, can you stick out your tongue for me? Perfect. So tongue is midline. Cranial nerve 12 is intact. And go ahead and clench your teeth. Okay. That is equal. And close your eyes for me. Let me know when you feel a cotton ball.
Yes. 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 Yes.
So cranial nerve 5 is intact. Trachea is midline. Carotids are +2. Checking lymph nodes. Preauricular, postauricular, occipital, jugulo-digastric, submandibular, submental, cervical chain, supraclavicular. There's no palpable lymph nodes. I'm going to go ahead and listen to lung sounds now. When I put the stethoscope down, just take a breath for me, okay?
Okay.
So posterior lung sounds are clear. Benton, I'll go ahead and have you lay down now.
Okay.
And I'm still going to be listening to your lung sounds, okay?
Okay.
Anterior lung sounds are clear. Breathing is non-labored and patient is on room air. I'm just going to be listening to your heart sounds now.
Okay.
Nordic, Colmonic, Eric's Point, Tricuspid, and mitral. Heart is regular and rate in rhythm. I will now listen to the carotids. Okay. No bruise or hurt. I will go ahead and elevate the head of the bed to 45 degrees. Ben, can you turn that way for me? And look towards me. Perfect. So no JVD is noted when the bed is raised at 45 degrees. I will go ahead and lower it back down and check his other peripheral pulses. Brachial. Radial. Post-tibial. And dorsalis pedis. Okay, so pulses are +2 and equal. And I'm going to go ahead and capillary refill is less than 3 seconds. I'm going to go ahead and inspect his stomach now. So his abdomen is rounded. There's no visible scars or lesions, no protrusions of any kind. So I will go ahead and listen to the aorta and the renal arteries. No bruise or hurt, so I will continue with the auscultation of the abdomen. I'll start in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Vowel sounds are heard in all 4 quadrants. I will start percussion. I will move to palpation. Let me know if there's any pain or pressure, okay?
Okay.
And deep palpation. Okay, so abdomen is soft and non-tender. I will go ahead and check out his musculoskeletal exam. So all of his muscle groups look symmetrical and even. And I'm going to go ahead and have you relax. I'm going to lift up your leg, okay?
Okay.
So hip flexion. You tolerate that okay?
Yes.
I'm going to bend your knee here. Any pain or discomfort?
No.
Okay. Okay, patient is tolerating the exercise as well. I'll have you go ahead and kick my hand and this side. Okay, perfect. Push against my hands and toes to nose. Okay, I'm gonna have you follow your foot with my hand, okay? So raise up, we'll go out, we'll go across, go back, and other side, up, out, across, So now I'll go ahead and have you move to the side of the bed and just leave your feet hanging over.
Okay.
Okay, so kick your leg out for me, bend knee, bend knee. Perfect. I'm going to go ahead and have you point your ankle and point it in and point it out. Perfect. Other side, point, in, out, and down. Perfect. And now we'll go ahead and stand up. We're going to test out your neck now, okay?
Okay.
So shoulder to ear, and bend down, and pull back. Perfect. And I'm going to go ahead and have you actually turn against my hand. Okay, and turn against my hand here. Raise your shoulders. Okay, perfect. So cranial nerve 11 is intact. Now we're going to check shoulders. We're going to do Superman pose. Elbows, shoulders back. Perfect. Bend your arms behind your back. Arms behind your head. And we'll do a triangle in the front. And raise it all the way up. Perfect. And all the way back. Okay, awesome. And we're going to bend your elbows. Perfect. And bend wrists. And fingers. Okay, awesome. Then go ahead and walk to the wall. Okay, turn around and walk towards me, but I want you to do heel to toe. Perfect. And just stand and close your eyes. Okay, so Romberg test is negative. Very good. I can have you go ahead and you can have a seat now. We're going to do some exercises.
Okay.
We're going to do thumb to finger. Thumb to each finger. Perfect. And we'll speed it up a little bit. Perfect. Next we're going to do, you're going to touch your nose and you're going to touch my finger. So touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Perfect. I'm going to have you close your eyes now. So this is going to be sharp and this is going to be dull.
Okay.
Okay, so I just want to tell me what you feel.
Dull. Dull. Sharp. Dull. Sharp.
Okay, perfect. Keep your eyes closed. I'm going to write a number in your hand and I want you to tell me what you feel, okay?
7.
Okay, perfect. I'm also going to touch you and I want you to tell me exactly where I'm touching you, okay?
My left elbow, my right shoulder.
Okay, perfect. And keep your eyes closed for me and identify this object.
Pocket watch.
Perfect. I'm going to check some deep tendon reflexes, okay? I'll have a table that's going to be at heart level for him to rest his biceps. I'm going to check triceps. Relax. And relax. Relax. And patellar. And Achilles. Okay, perfect. So Benton, that concludes my exam. Thank you so much for your time. I really appreciate it. Is there anything else that I can do for you?
No.
Okay, perfect. So I'll perform hand hygiene, return the patient's bed back to a comfortable position, and hand him his call light. And now I am ready for a report. So BH is a 49-year-old male here for exam. Patient is alert and oriented ×4, well-groomed, well-nourished, and dressed appropriately for the weather. Skin is consistent with ethnicity and there's no lesions or wounds. Vitals are as follows. Oral temperature 98 degrees Fahrenheit. Pulse is 70. Respirations are 20. Blood pressure is 112/70. Oxygen saturation is 96% on room air. There is no pain. Patient is a 23 out of 23 on the Braden scale. Head is normal, cephalic, face symmetrical. Trachea is midline with no palpable lymph nodes. Lung sounds are clear in all fields. Breathing is unlabored. Heart rate is regular and rate and rhythm. There's no JVD noted. cap refill is less than 3 seconds. Bowel sounds present in all 4 quadrants. Musculoskeletal system is symmetric and even strength with normal range of motion, and all 12 cranial nerves are intact. Thank you.